My name is Regina Hechanova-Alampay. People call me Gina. I'm a full professor of psychology at the Ateneo de Manila University. What is the state of mental health in the Philippines? About 1 in 8 Filipinos have a mental health problem. Unfortunately, only about 20% actually get help. Does everyone have fair access to mental health interventions? Not at all. Mental health programs are very expensive in the Philippines. People have to pay high out-of-pocket expenses for mental health services. And especially the poor, they cannot afford these mental health services. For the past decade, what we've been trying to do is to strengthen community-based mental health, which means delivering mental health interventions at the lowest level possible, whether it's the barangay level or at the level of local government units. These programs are delivered by trained providers, so they are more accessible, they are more affordable. The point of community-based mental health is that not everyone really needs to see a psychiatrist or a psychologist. Community-based mental health programs are programs that can be delivered for those with moderate mental health problems. So not everyone needs to see a psychiatrist or a psychologist. The problem of mental health in the country is that our specialists are concentrated either urban areas or in hospitals or in facilities. When a disaster happens and a lot of people are affected, there's no mental health specialist. And so the point of community-based mental health is to train people on the ground, what they can do to help those who are distressed. One of the first programs that we developed is a program called KKDK, Katatagan, Kalusugan at Damayan ng Komunidad. Our goal then was to provide people healthier ways of coping so that they don't need to use drugs as a way of escaping whatever problems or distress they have. The second point in KKDK is that it's delivered by the community in the community. In the Philippines, we treat drug use as a crime. But the evidence is very strong that drug use is actually a mental health issue. People use drugs as a way to escape problems or because they don't know how to manage their emotions. So they use it to numb themselves, for example. So it's important that we look at why people use drugs and treat the root cause, which is maybe they have problems that they don't know how to solve. Or maybe they want to be able to do things and they just don't know how. So they use drugs as a way to boost themselves. So what we want to do in community-based drug rehabilitation is to provide a health lens because we do believe that drug use is a health issue. Katatagan Online is now called Katatagan Plus. So during the pandemic, we know how people's mental health really became a problem. People were isolated, people were stressed because they didn't know where to get basic needs, people were afraid of getting the disease, and people were grieving because they lost loved ones. But because of the isolation, people could not seek help. So what we did is to try to bring a resilience program online. We trained psychology students, grad students, faculty on how to deliver resilience skills. And resilience skills are like, how do I manage my reactions to stress? What can I do when I'm ruminating and thinking all negative thoughts? What can I do to actually solve the problem? A lot of times when a person is sick, we only treat their bodies. And it's very rare that a doctor will treat both the physical as well as the mental. But my dream for our country is that when we talk about healing people, we heal both their bodies and their souls.
Metrobank Foundation Outstanding Filipino, Dr. Regina Hechanova-Alampay.